Welcome to Payment Matters. I'm your host, Jeff Lin. Thanks for tuning in today. On the show, we talk about the ever-changing landscape of healthcare payments and the impacts to healthcare payers, providers, and consumers. You can follow the conversation on Twitter at hashtag Payment Matters and follow me at Jeff B. Lin. Today, we have the privilege of talking about consumer engagement in the billing and payments process. And I'm joined today by our guest, Carolyn Rubin, who is a RevCycle consultant. Carolyn, thank you for joining us today. Can you tell us a little bit about yourself and your experiences?
Absolutely. Thank you, Jeff. And it's wonderful to be here today. I have been in the healthcare field for 25 years. I've been a RevCycle consultant the majority of that time, working with physician groups and hospital groups on everything from the time the patient makes their appointment until the time the claim is paid. So just helping them with end-to-end revenue cycle optimization.
Great. And so you've clearly have seen the industry change through the years and across the board, from how providers get paid and how we work with patients. Interested in your perspective, how have the changes in the patient payment responsibility really have altered or modified how providers view the patient or how the patient views the provider? What's your experiences and what have you seen?
Yeah, there's been a lot of changes over the years. It used to be easy for the patients. They could just call their physician, make an appointment, go in, maybe have a copay that was $5, $10 to see their physician, most of the time not, and they'd go in, see their patient or see their physician, have done whatever needed to be done and go on home. They didn't have to worry about referrals. They didn't have to worry about authorizations. They didn't have to worry about a physician being in network or out of network, or whether a procedure was covered or not covered based on their diagnosis. Was it cosmetic, not cosmetic? Things have changed so much over the last 10 years, more so in the last 2 or 3 years. And patients just don't understand what their insurance benefits are. And a lot of the times the physician's offices, even the hospitals, they struggle on even how to explain the benefits to the patients. There's an authorization that's required and the insurance company may deny it based on their benefits. And it's because of how the employer maybe structured their insurance and opted not to cover something. Or it may be that the premium they went with a lower premium with their employer, and it's because they chose the higher deductible, or they ended up with a coverage that didn't cover a particular service. So it's very tough for patients anymore when they decide to have a service covered. They may call and find out that the physician that they've been seeing for the last 5 years has decided to no longer take their insurance, even because of the reimbursement that particular payer was offering them. And providers just struggle on, how do I have that conversation with the patient and explain that to them? It's just an ongoing situation, and it's an ongoing challenge for both the providers and the patients to even figure out.
Yeah, it's interesting. So very complex as you think about, like the patients are confused by their benefits. They're walking to the providers who've, as you mentioned, they've been seeing for the past 5 years, and all of a sudden they're not accepting that insurance, or yes, they have no idea what the benefits mean. Right? They're denied to get that reimbursed. And really in this tri-party relationship, I call it the provider, the patient, and the payer here, how have you seen anything in terms of, and I'll kind of focus on the benefit side of the equation, in terms of how providers are engaging with these patients and understanding or helping them understand the benefits of their plan. Have you seen anything done out there that can reduce the confusion tied to benefits?
I wish I could say yes. In most cases, no. The individuals that are working to explain to the patients what their benefits are just as confused as what the patients are when they're calling the insurance company to try to figure out what the patient's coverage is. Sometimes they're not asking the right questions, or they're asking the same questions that they asked yesterday or last year, only to find out when they submit the claim that they should have asked that question a little bit differently. For example, the patient may have been getting an injection or a particular medication whenever they went to their physician's office, and they've been getting that injection for their particular illness monthly for the last 2 years, and it's always been paid at the physician's office. Well, their plan changed, and now it's underneath their pharmacy benefit versus their medical benefit. But because when they verified the insurance, they didn't ask about the particular codes or the particular medications or the particular services that patient was receiving. All they asked was if the patient still had benefits, if they still had coverage, what their out-of-pocket was or what their copay was. So they got the same information, but they didn't ask about the specific services. So now all of a sudden the claim is denied, and they're having to explain to the patient that their benefits are no longer the same, and they now have to get this drug from the pharmacy, or they have to go through a specialty pharmacy to get that prescription filled, and it's now a higher out-of-pocket for that patient. So if they don't know what questions to ask, or if they're not asking the right questions at the physician's office, then they're not getting the right information for the patient. So it's just as confusing, and it's just as complex, and it all is because of maybe the education or the understanding on the staff at the physician's office to know that benefits have changed, or that there's different questions that need to be asked.
It's almost as if the relationship between the patient and provider, they need to be working closer together to really understand what's covered, what's not covered, really the payments that are going to be happening. But have you seen that relationship get better or worse, or stayed the same over the past 5-10 years?
Well, it pretty much, it stays the same in some aspects. Because of the confusion, it gets a little better in some aspects if they have a true advocate at that provider's office that they can talk to, that truly understands what's going on. A lot of the times what happens is the patient has to go back to their HR person or their employer to say, why isn't this covered anymore? And we have to ask that patient, what are their benefits now? It's getting that patient involved more to understand what their insurance is doing. Patients used to just sign up for insurance and they would understand they had a copay, or, they went to this pharmacy and their medications was X amount of dollars. And they don't have quite the understanding of what their employer benefits are. And so, they just expect to be able to go to the doctor or to be able to go to the pharmacy. Well, there's so much that's going on, and there's so many changes that are happening at every single payer level, whether it's Medicare, the Medicare Advantage plans, the Blue Cross, the Cignas, the United Healthcares. There's so many changes that are taking place that it's tough for staff at a physician's office to really keep track of all of that. Well, if they sit down and really take the time and talk to that patient and to look at that information, they can help that patient understand. But because of all the changes that are taking place also on the regulatory side, when we talk about, HIPAA and patient privacy and where you can have those conversations and how you can have those conversations, a lot of the challenge is having the conversation, not delaying the patient from their appointment, because they're typically, trying to get them back to see the physician, and the patient's wanting to get back to see their physician. So you're trying not to delay the appointment. You're trying to have the conversation. The patient's scared to have the conversation because they don't have the money to pay that high deductible. So they don't know, what are their options, so to speak. And the person at the front desk may have only been there for a week or 2 weeks, maybe even a month, and they've not truly had the type of training to have the type of conversation they need to have as well. So, kind of a convoluted answer and a complex answer to go with a complex situation. But
right.
It really all comes down to the fact that, as things get more complex with the industry, it's more complex to educate the staff to have the type of conversation that they need to have with the patient, because there's just too many changes, too many options, and too many variables that come into play.
Yeah, it's very complex, and I wish it was there's a magic bullet to solve everything, right? And
yes, exactly.
I wish it was, right? And you mentioned before, which is, co-pays used to be the norm, right? $20, right. And that's all you would pay, right?
Right.
And I remember back in those days, and then you wouldn't get a bill. That's all you paid is that copay.
Right.
But high deductibles and so on becoming more in vogue. We had another guest on who his comment was the last impression is the lasting impression.
Right.
Meaning, and we take a look at that, which is you tie that to, at the end of the day, payments.
Right.
The billing process, all that stuff that needs to occur with the patient, and how to communicate with them, and the payment process. There's clearly some struggles there, and I would love to kind of understand what have you seen in terms of those struggles, especially how complex it is, understanding these bills, kind of what you've seen in your experiences tied to billing, billing to the patient and collecting those payments.
Yeah, it's interesting, and even yesterday I was having a conversation with an individual who was going through the same frustration. She had to have some tests ran at a hospital, and she went in to have an MRI done, and she went in to have a CT scan completed, and she had to have some other tests completed. And she saw her physician first, who said, I need you to have this done, and this done. And she's like, okay. So she went to each of the departments to have her test completed. And each one of them, when she got there, said, okay, we'll have you, we'll get you in to have your MRI done. I need $350 because that's your out of pocket. And she was like, okay. And then she went to have her CT scan done. And before they would do the CT scan, she was like, it's $1,700 that I need today for you to have your CT scan done. And she's like, what? And that's what it's come down to is, it used to be that you would go in, you'd have your procedures completed, they would submit everything to insurance, and then you would get the statement, and, you could make you would pay whatever your out of pocket was, or you could call and you could set up payment arrangements and you could get it, you could take care of it at that point in time. The problem that we have today is that the high deductible plans that everybody is on are very high deductible plans. So most of them are, $3,000, $6,000, $10,000 that patients are signing up for on these high deductible plans. The ACA plans, the Affordable Care Act plans, some of those start out at $7,500, and or higher. And these patients, they don't have that, so they're getting the bills in the mail and they're pitching them. They're sending them right on to the trash can. They're not even opening that mail. And so it's trying to figure out how you can actually communicate with the patient and give them the options and help them understand what is available to them before you actually just send a statement out. And the easiest way to do that right now is to really engage that patient from the very beginning. And it's not just saying, you owe me $1,700. It's helping them understand, this is what your benefits are. Here's the options we have available. Here's how we can take care of this for you. And let's make this easy for them, right? So let's open up some online portals. Let's be able to save their card on file. Let's be able to put a payment plan in place that they're going to be able to capture every single month. When you look at consumers today, whether it's healthcare or a car payment or a house payment, everybody has payments that we're making. And let's not even look at a house payment or a car payment. Everyone has cell phones today. Everyone is, watching TV of some sort, whether, they're watching Netflix or they have cable TV or they have satellite, something to that effect. But we all have those different options. And it's sitting down and really having that conversation with the patient to see what options are best for them. So if you talk to them in that direction and really engage the patient to figure out what works for them, you'll have a very successful conversation and it'll make it easy for that patient, but they need to know what their options are. If you just say to them, I need $1,700, they're going to look at you and go, yeah, well, that's not going to happen because I have a house payment, I have a car payment, I have groceries I need to buy, I need to do this, I need to do that. And what's going to end up taking place is that patient's not going to end up having that test done, or they're not going to end up having, that they're not going to make that doctor's appointment, or they're not going to get that medication filled. So it's truly engaging the patient. It's connecting with the patient with the right type of conversation, and it's educating the patient to the different types of options that are available. And, right now I will tell you that every single provider's office that I have worked with in the past and that I have talked to even as of today, that is where their struggle is at, is having that engagement, having that patient engagement, and having that true connecting conversation where they truly can lay it out and help that patient understand that they're not there just to, wipe out their checkbook. They're truly there to educate them on what's available.
What would you say to those providers that are saying, we're too busy, we can't really be focused on this additional activity of educating and working through these payment options? Kind of what would be your response to them if they said that to you?
The first thing I tell the providers that I work with is to quit telling the patients not to worry about it. So many providers, because patients will pour their hearts out to physicians. And that is, the physicians, they don't want to worry about finances. And I don't want physicians to get involved. To be quite honest, I don't want physicians to get involved in that, because the first thing physicians do is they say, oh, don't worry about it, we'll take care of it. It's okay, Susie will take care of it for you. I'll talk to Susie and we'll take care of it. You just need to worry about getting better. Don't worry about it. Don't worry about it. And the first thing the patient thinks is, oh, I don't have to pay anything. And I'm like, quit telling them that. Don't do that. Right. What I want physicians to do, and what I always tell my physicians that I'm working with to do, is to let the patients know that, hey, we'll look at your benefits and we have multiple options available for you. We will provide you with the best quality financial care, as well as we'll provide you with the best quality medical care. So we're going to make sure that you can focus on getting better, but you need to work with Susie on your insurance, and you work with me on, whatever I need you to do medically to get better. And between Susie and I, we'll get you there. But I need the physicians to acknowledge that things have changed on healthcare. And, they're getting it. The physicians understand if they hear it from their financial people, they understand that they can no longer say to patients, don't worry about it. Because if they do that, they will no longer get the reimbursement. They'll no longer get the revenue for their services, because 9 times out of 10, these patients have the high deductibles and the high out-of-pockets, which means everything that they're doing for that patient is not getting paid unless this patient pays their bill. So it's very important that physicians understand that they have to support Susie having the time to sit down and educate the patient with what their benefits are and what the resource, what benefits they have available to help, what payment plans are available, what services are available for that patient. And it may be that the patient, qualifies for, financial assistance, maybe a program that they have available even internally within their own organization. But they have to, support that. And sometimes, and I'll tell you, as I'm going in and talking to different organizations, it may mean that they need to hire an additional financial advisor in order to have the right amount of people to really have those conversations. But it pays for itself at the end of the year. The ROI, the return on investment of having that additional financial advisor to spend time with the patient is well worth it, because you get the dollars in the door. Where before, if the physician's saying, oh, don't worry about it, I don't want you to stress over it, and then the patients just never pay anything, it becomes bad debt. Well, bad debt doesn't pay the salaries. It's the patients paying their bill that pays the salaries. So I need physicians to actually support their staff having the conversations with the patients. And I just want physicians to let the patients know that they're going to receive quality financial care and quality medical care while they're there at that office. And whatever help they need, they're going to get it, because they've got the best people to make sure that that happens.
Got it. Yeah, and that's some great feedback here, which is, we've heard this. I've heard the old adage, which is, people, process, and technology, right? You need those 3 things in order to, in effect, impact change. And as I kind of think about our discussion today, technology, offering payment options, online portals, payment plans, doing things in an automated fashion. But that's not going to save the day, right? You have to get the people on board. You have to hire new people and talk to them, and actually build in potentially some processes, right, in place to get like maybe charity assistance or other kind of care tied to that. In your experience, and as from a ROI, I think you focus on ROI. Are there any it's tough to tell someone to go hire more people to do more things, and there's a pretty good chance that you'll make up that money, if not more, but by doing that. And any sort of anecdotes or financial insights you can provide to our listeners to say, what have you seen? Like, by doing this, you can reduce your debt by so on, or increase collections. Have you seen any measurable metrics or any kind of horror stories that you've seen changed over that can maybe shine a light on like real examples about what can be done if they take on those activities that you alluded to earlier?
Yeah. I've seen both. I've seen horror stories and I've seen, great results come about. So many times you hear, you're talking about technology and I've heard so many times I'll hear different individuals go, oh, technology, patients hate it. They don't like going out there and using technology. They don't want another login. They've got all of this they have to do now because we have to make them use the patient portal. We have to make them do this. And, what I have found is that patients actually will do it if you make it easy for them to do. And the staff will do it if you give them the right tools to do. And it's something that is beneficial for both the staff and for the patient. And it makes sense for everyone to do.
That's great. Well, Carolyn, thank you so much for your insights today. And I learned quite a bit in terms of what providers and patients and how payments and things have changed so much over these years. And for the listeners, these are the important payment matters that healthcare providers and consumers are really tackling today. And thank you to my guest, Carolyn Rubin, for joining me today. Where can our listeners go to learn more about you and your organization?
They can go to my website, carolynmrubin.com, or they can find me on LinkedIn, Carolyn Rubin.
Well, good. Definitely a wealth of knowledge. And once again, thank you to everyone, including Carolyn, for joining us today. And remember that you can listen to this episode weekdays at 4:30 a.m., 12:30 p.m., and 8:30 p.m. Eastern. If you have a comment about that episode or the show, follow #PaymentMatters or connect with me on Twitter at Jeff B. Lin. You can learn more about my show at healthcarenowradio.com or instamed.com. Until next time, I'm Jeff Lin.